Hello, and welcome to the Things I Want My Daughters to Know podcast, the podcast redefining women's health, one unfiltered conversation at a time. I'm your host, Jacqueline Rose, and every week I'll sit down with leading women's health experts and real women to share their lived experiences, bust health myths, challenge outdated and uninformed narratives, and explore what's really possible for women. We'll talk about periods, fertility, menopause, hormones, aging, and everything in between. This podcast is for every woman who ever felt confused, dismissed, or left out of the conversation about her own health. It is a space to celebrate women, break the silence, and open up conversations between mothers, daughters, sisters, and friends. Please hit the follow or subscribe button so you don't miss an episode, and share this podcast with your daughters, family, and friends. Let's get on with the episode. Hello, everybody, and welcome back to another episode of the Things I Want My Daughters to Know podcast. And today we are going to be talking about a topic we do not talk about enough, a topic that is very dear to my heart because of my yoga background. We are going to go down some really interesting rabbit holes and have some really interesting conversations, and hopefully some myth busting conversations all about our pelvic floor muscles and about that whole area of women's health. And to do that, I have Chloe joining me today. Welcome. So happy that you're with me. Tell us a little bit about who you are, what you do, and we'll jump straight in.
Okay, so my name is Chloe. I am a pelvic health physio. I trained in pelvic health after having my daughter in 2019, mainly because I was a little bit miffed that nobody checked on me to make sure I was okay. It was very baby focused, which is good and needed, but nothing happened to me. So started going to mum groups, realized that there were a lot of women that were absolutely clueless with pelvic health. So I decided to go from being a normal MSK physio and trained in pelvic health. So I basically now spend my time teaching other women how to strengthen their pelvic floors successfully and correctly. I work a lot with women who have prolapses, who have been told that surgery is their only answer when it's not. And I teach pelvic floor Pilates for women with prolapses to really just give them their quality of life back and to stop with the you can't lift again and you can't go to the gym and you can't do this, which is what we get told with prolapse. So that's basically what I do.
Amazing. So I want to really go back to basics to really understand what these pelvic floor muscles are, or pelvic, why these are so important to women's health. As I mentioned, I come from the world of yoga. I'm trained in lots of different yoga modalities, but the focus of my yoga was always yoga for women's health and really understanding the role that pelvic floor plays in women's health. Because I think one of the myths that I really want you to bust is pelvic floor is only relevant for pregnancy and birth. That's the only time we ever really talk about it. Or when we have problems such as prolapse. Other than that, no one's thinking about it. You may think about it if, as what happens with many women, there's leaking or incontinence, or, if you're a runner and you need to wear a pad because when you run, you're going to leak, or, you go out dancing and you have to wear a pad because you're going to leak. So we only look at it as when it's not working, or in those two very extreme cases of birth or prolapse. So let's start at the very beginning. Explain a little bit about what this area of the woman's anatomy is and why it's so important for women in general.
Okay, so your pelvic floor is a muscle that we don't see, and it's a good thing that we don't see it. It sits at the bottom of our pelvis and it keeps our innards in, is the best way to describe it. It also helps us stay continent. We need it for sexual performance as well. It's a really, really crucial muscle. And the only time, like you said, is when we become aware of it is when there is an issue with it. So our pelvic floor sits there, it does its job, it quietly goes on, carries on, and we don't do anything because we don't see it and no one really talks about it. And you're absolutely right. We only start doing something when a problem happens, or when we start to get symptoms, or we are in pregnancy and then we start thinking we need to strengthen it with all our might to get strong. So I think we miss the pelvic floor quite a lot as a group, though, that group of muscles, because we don't see it. But if
Yeah.
our arm withered away, we would do something about it because we
Yeah.
can see it.
Yeah. And I think you touched on something there, which I don't want to spend too long on, but I do just want to emphasize. You said part of the job of those pelvic floor muscles, sort of this like network of muscles that sit at the base of the pelvis, is to keep all our internal organs in place. But you also said about sexual function. And I
Mm-hmm.
want to sort of stay on that point for a minute, because a lot of women who may have painful sexual experiences, sometimes it's about the pelvic floor muscles, and no one talks about that. They'll make all
Yeah.
other excuses or all other explanations as
Yeah.
to why it hasn't been, why you as a female may be having an unpleasant sexual time. But no one is saying maybe there's an issue with the pelvic floor muscles,
Mm-hmm.
because that's exactly where they sit. Those are the
Yep.
muscles that are being activated and stimulated when you have intercourse.
Yes, exactly. And if you are slightly tight in your pelvic floor, which I would say the majority of people are, because our pelvic floor is linked to our fight and flight system. So if you are
Yeah.
stressed or anxious or
Yeah.
worried or
Yeah.
even just rushing around, you will have tension in that pelvic floor. You won't be diagnosed as, and I'm going to say hypertonic, which is a condition where you just keep tension in your pelvic floor, and that can lead to
Yeah.
painful sex. And a lot of women then don't want to have sex, and they don't want anything because they've got this tension in their pelvic
Yeah.
floor. And because we
Yeah.
don't talk about it, they think that's it, we're done, and nothing can happen. But there are loads of treatment, and this is where we come into breath work. Breath is so important
Yeah.
in relaxing that pelvic floor, relaxing you, and just settling down your nervous system from being stuck in your fight and flight to get you into your rest and digest. A lot of
Yeah.
the treatment I do with ladies that I see is breath work,
Yeah.
first and
Okay, so
foremost.
we're going to get to that to a second, but I want to go back, and I again want to stress this point, because you're saying so much important stuff that women don't
Oh,
know. Um, I think there is another myth that actually our pelvic floor muscles are weak and relaxed because we've got incontinence, we've got leakage, we've got,
mm-hmm.
you've got to hold
Yep.
it in, that Pavlovian response where women get to the front door, they turn the key, and all of a sudden they need the toilet.
Yep.
So we live under this myth that our pelvic floor muscles are actually too relaxed, too weak, and we need to strengthen them. I know we're going to talk about Kegels in a minute, the whole practice of strengthening and tightening our pelvic floor muscles.
Mm-hmm.
But I want to stay on what you said, that actually that is a myth that women have too relaxed and too loose pelvic floor
Yep.
muscles. In many situations, and women do not know this, they actually have too tight pelvic floor muscles.
Mm-hmm.
And I want you just to explain what that could look like, what that could feel like. How would a woman know that she has too tight pelvic floor muscles? And then, and then I want to go a little bit more into the biology of the relationship between the breath and the pelvic floor muscles.
Okay, so there's some things that are a giveaway which aren't even near your pelvic floor. So if you clench your teeth at night, and if you have a tight jaw, or if you know that you hold tension in your jaw, your pelvic floor is also tight. If your neck and shoulders are also really tight, your pelvic floor has got some tension in it as well. I'll try and bypass the breath slightly, but if you know you breathe all at the top of your lungs, chances are
If
you've
you
got that.
shoulder breathe, if there's a lot of
Yeah.
shoulder breathing,
Yeah.
inhale and exhale with the shoulders.
Yeah, you do that nice breath in, shoulders come up around your ears. If you are one of those, then you will have tension in your pelvic floor. But there's other symptoms as well. And this is where there is muddy water and people get confused and start doing loads of Kegels. But if you have urging incontinence, key in the door, need to go, you'll have tension in your pelvic floor. If you have lower back pain, if you have tailbone pain, or one side of your pelvis pain, that's most likely down to your pelvic floor as well. If you painful sex is a good one, that will be tension in your pelvic floor. If you have urge sensation, but not so much the incontinence. That's tension in the pelvic floor as well. And your pelvic floor can be tense, but it can still be weak. The only time you can say, I have weakness in my pelvic floor, is when you have incontinence with coughing, laughing, and sneezing. We know that is weakness in the pelvic floor. But a lot of your symptoms when it comes to incontinence and with the back pain as well is because it's too tense and we need to relax it first.
Amazing. Amazing. Okay. So we understand too tense. We understand maybe, too weak, or, the muscles are sort of, it's really about muscles not functioning the way that they should be. Talk to me, and you've said that it is definitely related to stress, which I agree 100%. Explain to me, though, well, let's talk about Kegels first. So the obsession around them, and then maybe why they may not be so productive and helpful for women. And then we'll go on to the relationship between the breath work and the pelvic floor.
Okay, so this is one thing. If you really want me to start grinding my gears and having a little rant, is that as a woman you start to have symptoms, and maybe it is postpartum, maybe it's perimenopause, and you start to notice that you've got a little bit of incontinence. You will then go and see your doctor, and your doctor, I'm going to say 9 times out of 10, I'm putting it out there, will say you need to do more Kegels. So off you go and do your Kegels. And your
they won't
symptoms...
refer you to a pelvic floor physiotherapist.
No,
that's the first the first, I think, alarm bell that should be ringing. Your doctor should be sending you to the specialist,
absolutely,
a pelvic floor physiotherapist.
Absolutely. But they think, oh, just do your Kegels. It's because it's weak. Go and do your Kegels.
Right.
And I can't tell you how many women have come through my door and said, oh, but I've been doing pelvic floor exercises, but my symptoms are actually worse. And it's like, yep, because your pelvic floor has already got tension in it. And what you're trying to do is tighten a muscle that's already got tension in it, which then leads to, and I hate this word, but it does lead to more of a dysfunction with it. So there's, you're tightening a muscle that's already tight, which means that when you need it, it hasn't got scope to move. It can't give you the support it needs because it hasn't got anything left in it. So your symptoms get worse. And these medical professionals go, oh, just do your Kegels. But there isn't any kind of, right, let's relax everything. And especially, I think women postpartum and women that have been told that they've got prolapses go into that, oh, hold everything in. Oh my gosh, just squeeze everything in because everything feels like it's going to fall out. And especially postpartum, like your body in that area has gone through trauma. So that trauma causes those muscles to be tight. Muscles are really, really tight. You then try and tighten them more. Your symptoms get worse. And it's all because a medical professional has said, just do Kegels.
So I know this isn't sort of the essence of our conversation, but where did these Kegels get such reverence that they are the practice? And again, it's just purely about tightening those pelvic floor muscles. No conversation about how muscles work, but muscles need to relax and contract. Relax and contract, and that's a functioning muscle. No conversation about the relationship between these pelvic floor muscles and the diaphragm and breath work. Just a pure obsession about sort of tighten them. Where did that even sort of start from? Why has that become like the benchmark of what women need to be doing?
I genuinely don't know, but even as when I went through my training, it was all very heavy on, right, Kegels. This is how we assess a woman. We do it internally. We feel them do their pelvic floor contraction, and there we go. Jobs are gonna. We rate it on a scale. Go and do it. And you think, okay. And it's not until you have a little bit more training and probably a little bit more knowledge that you need to think outside the box. And not many medical professionals, I would say, are good at thinking outside the box, because yes, we need to relate it with the breath work, but also your pelvic floor needs help from the surrounding muscles. So if you are, if your tummy muscles aren't as strong as they should be, or your bum muscles aren't as strong as they should be, your pelvic floor is probably clinging on for dear life to give you the support your body needs. And especially, postpartum, or even it doesn't matter if it's 6 months postpartum or 20 years postpartum, if no one's come around and checked
Yeah,
that your stomach muscles are working again, something else is going to take the brunt. And it's normally your pelvic floor.
pelvic floor muscles. I think it's just another example of how women's health is so misunderstood within the healthcare world,
Mm-hmm.
within, the health, yeah, like just even the most basic anatomy and biology of women,
Mm-hmm.
men don't have, they do have pelvic floor muscles, but it doesn't function in the same way, and therefore it's not relevant, and we don't really need to understand how they work. And yet they're used because, if a woman gives birth vaginally, so they're going to be stretched and, expanded, and therefore we probably have to tighten them up after that experience. And it's just an absolute, a profound misunderstanding of women's
Mm.
health at its most basic.
Yeah. I think it's trying to get through all the fodder that is out there. But if you Google or whatever platform and to find out, like, these are my symptoms, what should I do? Kegels. And
Yeah.
it's not the amount of women I've treated by not even doing any form of pelvic floor strengthening, Kegel work with them, thinking
Yeah.
outside the box, getting everything else strong, getting the breath work strong, and then we move on to
Yeah.
it. And it's been a game changer for a lot
Yeah.
of women
Women.
because it's not
Okay.
just strength, strength, strength.
So let's talk about the relationship between breath work and pelvic floor work. I haven't discussed this with you, so I don't know what your approach is, but I want to hear your approach. I'll share my approach. I'm
Okay.
assuming there's going to be some overlap between them. But sort of tell me the role that for you breath work plays when you want to work, when you want to I'm going to say strengthen the pelvic floor muscle, but when I say strengthen, I don't mean tighten. I mean make sure they're working the way they need to be working.
Yep. Okay. So the diaphragm plays a key role because your diaphragm and your pelvic floor need to work in unison, really. They shouldn't
Yeah.
be a force against each other. So, first off, we need to make sure we're using our diaphragm because a lot of us aren't. And if you're not
Yes.
using your diaphragm, you unfortunately can't get yourself into a rest and digest state, and you stay in this fight and flight, which means you've got tension already in your pelvic floor. So, what we need to do is get that diaphragm engaged with your brain, and we need to then get the pelvic floor working with it. And a lot of women come in and say, oh, I do a pelvic floor contraction on an in breath. And I've heard it from name huge person in pelvic health, which
Yes.
is
Yes.
alarming. So the
Yes.
first thing I'm going to say, please, 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 when you're doing a pelvic floor contraction, do it on a breath out.
Yeah.
And the reason you do it on a breath out is because when your diaphragm lifts, you want that pelvic floor to lift as well.
Yeah.
If you do it on an in breath, all your diaphragm's going to do is shove down on that pelvic floor, make it harder, and you're setting yourself up to fail. So we
Yeah.
need that
I
diaphragm to
took
work
it.
with the
I
pelvic
agree with
floor.
you 1,000%. I talk about your diaphragm and your pelvic floor muscles need to work in sync. And basically, you've got that stomach, the diaphragm is here, the pelvic floor muscles are here. You've got the stomach cavity, all the
Mm-hmm.
internal organs sort of in that over here. And they've got to go up together and down togeter. So
Yes,
it's
exactly.
basic biology. This is the problem. We don't understand the basic female biology, and anyone, any big name, whether it's a menopause person or a pelvic floor person or any of these people that are spouting some real nonsense, it's nonsense because it's basic biology of how our female anatomy
Mm-hmm.
works. And if
Yep.
you are talking against female anatomy, it doesn't make any sense. So you want to be thinking about that diaphragm and the pelvic floor muscles going up together, going down together. And I
Mm-hmm.
think that it's so 100%. I just wanted to use that analogy. Carry on. So what does that mean to really have that diaphragm working? How would we want someone to be breathing in the right way?
So I run through the first thing I run through as with them teaching Pilates, seeing someone face to face, I kind of call it a reset. And it's a good way of checking in with yourself. And it's not just thinking diaphragm. So I get my ladies to lie down on their back, knees bent. First and foremost, this needs to be in a nice chilled out environment. You can't think that you've got to empty the dishwasher or the kids need picking up in 5 minutes. So end of the day before bed is perfect. And the checklist I run through is your jaw nice and relaxed? Is your neck and shoulders nice and relaxed? And then I get them to breathe in for a count of 4 and out for a count of 4. And it's surprising, on that in breath, they get to 3 and go, I can't take another one. And what that breathing pattern helps to do is get that diaphragm engaged again. So if you breathe all at the top, you'll struggle to get that diaphragm kicking in initially. And then when you do breathe, you want to think of your lungs going out to the side, your rib cage out to the side, rather than lifting up. And your belly needs to be soft. Just let it all out. Let it just go nice and floppy so that you can fill the space with your diaphragm and get a lovely breathing pattern. And if you can start doing that, it will start to get your brain used to using your diaphragm if you haven't for a while. So after pregnancy in particular, I'll use my son as an example. He loved to wedge his bum under the right side of my ribs. So when I first started, when he got out, when I wanted to use my diaphragm, it hurt me because he'd been pushing against it for so long. I was so tender. And my first thought was, I'm just not going to use it. But then pelvic health brain kind of kicked in and went, I need to do this. So postpartum, just kind of getting used to breathing like that. Because as soon as you start breathing like that, you naturally will get a lovely flow happening with your pelvic floor as well. And also importantly, it will naturally relax it. So if you then want to do a pelvic floor contraction, it's in a nice relaxed state to do a nice lovely pull up rather than in this tense, oh gosh, what are we doing? Now you want me to pull up.
Yeah, I think that's a really important point to notice, that when you inhale, the pelvic floors are relaxed, the diaphragm comes down, there's that nice expansion. And then when you exhale and the diaphragm comes up and the pelvic floor muscles are contracted and engaged and come up with them, it's not a body contraction.
No.
The body should be nice and calm and relaxed. It's not like, right, I'm lifting up my pelvic floor muscles and everything gets tight, everything gets tense. The only muscles that are working, and this is why I love that you focus on the breath first, is that gets the body relaxed. And then the only muscles that should be working are those pelvic floor muscles. The rest of the body is lying on the floor, and chilled and relaxed. Really important, because a lot of women will do their Kegels and they'll tighten their butts, they'll tighten their legs, they'll tighten their hips because maybe they can't identify the pelvic floor muscles specifically, or because they're not isolating them enough and they think, right, that whole region has to be contracted. So really, really important point that it's not a body contraction, it is a specific muscle contraction.
Exactly. And these little cheats, it's really hard if you've been doing pelvic floor exercises and maybe doing them wrong. I'm not saying that everybody is, but these subtle little cheats like tilting your pelvis, squeezing your bum, bringing your knees together, they're so subtle, but they're enough to make your brain go, oh, I'm just not going to use pelvic floor fully, I'm squeezing my bum instead. And it's trying to get out of that habit, I think, is what it comes into, and really engaging with the pelvic floor and really feeling what's going on with it. And especially if you've had a traumatic birth, maybe you've torn quite badly, needed stitches, you have that kind of, oh, I don't want anything to do with down there. And your brain thinks that as well.
Yes.
So then when you think, oh, I should do some pelvic floor exercises, you're like, what am I doing? Why is my bum going? My toes are curling, everything's gripping, and there's zero connection. So if you can start by kind of running through that reset, it will helps hugely, because everything softens and your brain will feel happier before you then try and do a pelvic floor exercise.
And some women may ask, how do I relax it? Like, how do I know it's like, where is the effort? Is the effort on the relaxation, on the relaxing the muscles, or the effort on the contracting the muscles? And I think also, like, if a woman has tight pelvic floor muscles, maybe she's scared about relaxing them. Maybe she doesn't know how it feels. So what type of guidance do you give around that?
So I would say, slightly controversial probably, I would say the relax is more important than the contracting of the muscle. And if you are, and disengaged is a bit of a clinical word, but if you really have kind of gone, oh no, nothing, I don't want anything to do with that. And normally people who've been diagnosed with conditions where their pelvic floor is quite tight, they want nothing to do with that area.
Yeah. Yeah.
Running through that reset, and definitely the breath work. I think this is where breath work is key, because if you can get that diaphragm working and you are relaxed and calm, your pelvic floor relaxes. You don't
Yeah.
necessarily feel anything.
Yeah.
It will just
It's
relax
not it's
because
not
you
an
are.
active thing that you have to do.
No, no, definitely not. And there's tricks that we can do if you've got really disengaged with what's going on. You haven't got a clue what's going on. You can roll up a towel and sit on it if it's not too tender, and try a pelvic floor kind of pull up and then relax. And some ladies there will feel the pelvic floor soften. So if
Yeah.
you've got zero input and you go, no, I've got a clue what's going on, sitting on a rolled up towel, like
Yeah.
front to back, try a pelvic floor contraction, a Kegel, and then let it go and just see if you can feel something, because that
Yeah.
just helps the brain connect to it again.
Yeah. 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 Amazing. Okay. I want to talk about prolapse because it's something that is very, very common, very talked about. But I just want to talk before we get there to discuss how pelvic floor changes as we navigate through perimenopause and menopause, because we know that things do change. Often there is
Mm-hmm.
increased incontinence, increased leakage. So, what is going on with our pelvic floor muscles as we navigate through perimenopause and menopause?
Okay, so perimenopause and then menopause is the change in hormone levels. Mainly, like estrogen is the biggie here. So estrogen is in near enough every cell in our body, and in
Yeah.
particular when it comes to muscles, lowering estrogen levels means that we lose tone a little bit. So ladies who have been absolutely fine, no symptoms whatsoever, no incontinence, no prolapse
Yeah.
symptoms, fine, they will hit perimenopause, have these fluctuating hormones, and then think, oh, hang about, why is this happening now? And they, whether they've had a baby or not, doesn't really matter.
Yeah.
So basically it's estrogen levels that are lowering that makes the muscle not function as well as it should. So it doesn't give you
Yes.
that nice strong contraction that it previously did, which can then lead to having incontinence symptoms or prolapse symptoms. So that's
Yeah.
why a lot of ladies feel fine after they've had their babies, but then they hit perimenopause, and these are when these symptoms can
Yeah.
come in.
Yeah.
Okay.
So let's talk about what is prolapse, how it's happening, a bit of sort of why it's happening. Can you, at that late stage of prolapse, we sort of what are the options available? We talk, I want to touch on surgical or other medical interventions, and then
Mm-hmm.
if physiotherapy at that stage, is it too late, type of thing?
Okay. So prolapse, to keep it brief and not too gory, is when you can have another organ entering the vaginal cavity. So the most common ones are, you can have your bowel coming in, your bladder, or your uterus, and they've got their names. I won't bore you with those, but and the symptoms can be that you can feel this heaviness, this dragging. You can feel like a tampon that's not quite right. You can feel a lump. You can sometimes feel a lump with sitting, and you can get some lower back pain as well. Like everything we like to do with symptoms is we grade them. And one thing I would say is 50% of women who have had one vaginal delivery have a risk of getting a prolapse.
Mm-hmm.
When you have two vaginal deliveries, that goes up to 80%. So a lot of women also walk around with prolapses but don't have any symptoms. And as a pelvic health physio, and I think any medical professional, we're not trying to cure your prolapse. I want to put that. We're not going to try and get rid of it, but we're trying to make you symptom free,
Right.
because there will be some
It can be
element.
very unpleasant for some people.
Yes, it can be. I mean, the worst one you can have is when it's actually leaving the vagina and it's external.
Yeah.
And I think at that point, you mentioned kind of, is it too far? It would really depend on, we can do lots of things to try and reduce your symptoms. We can try and get you stronger in terms of hips and pelvis and get your breath better and everything else. But I
Yeah.
always say, when people are going, I just want the surgery, I just want the surgery to get it done, is always try conservative methods first, but it's down to your quality of life. Because
Yeah.
women, there's pessaries that you can use instead now that can stay in for 3 to 6 months and work wonders and avoid the surgery side of things completely. And I think more ladies now are less wanting to do surgery because they've gone, oh, but we can try this stuff first.
Yeah.
So there
and
are elements
if it's earlier stages of prolapse, is pelvic floor work a really good viable option?
Yes, but the emphasis is it's not just pelvic floor. You can't just do pelvic floor.
Okay.
So if you're seeing a pelvic health physio at the minute and all they're doing is giving you pelvic floor exercises, ask them for some strengthening work for your hips and your pelvis. Ask them for some breathing techniques as well. But yes, definitely. So on the early stages, if it's not leaving and it's not become external, then definitely try pelvic health physio first, because there's a lot that can be done. I've had ladies come in that are going, oh, I'm not too sure whether this will help you. They've gone on, they've done their thing, come back, and their symptoms are so much better. And I've actually been shocked because I genuinely thought we wouldn't get very far, but they have. So everybody is so different. It is definitely worth trying before just going down the surgical route.
And I just want to say, it's not that, I don't know what your thoughts about surgery are, what you've heard anecdotally from, clients, but I think there can be a lot of unintended complications, side effects from pelvic floor surgery. Obviously, if surgery is required and if it's really the only option, we're not saying don't do it. But I think there are too many examples of problems that have arisen from pelvic floor surgery intervention. What are you seeing? What have you heard?
So around me locally, it hasn't got the best reputation.
Yeah.
It seems to work for a very short period of time, and I'm saying like 6 months to 2 years, and then symptoms come back. Sometimes symptoms come back worse. Sometimes they're just exactly the same as they were. And then you can be a little, depending on the surgery you've had, you can be a little bit, there's not as many options that you can try afterwards. So I always say with women considering surgery, a little bit of a pinch of salt. Yes, everybody loves a quick fix. Everyone would love it just to be like, jobs are good and done. I've had the surgery, I'm fine. But I think when it comes to prolapses and pelvic health, it is so much, it's worth putting in 6 months, 12 months of the conservative measures.
Yeah.
If it works, brilliant. If it eases your symptoms slightly and you improve your quality of life, even better. But even after you've tried it, I think then it would be go down the surgical route. Don't just instantly jump into it. That's what I would say.
Yes, I agree with you 100%. I think it is very often thrown out as the only solution. And I think women need to know that there are other options and, reliable, trustworthy, viable options that are not so invasive. Okay, I want to go back a second and talk about, you mentioned vaginas. We have not yet talked about vaginas, and I don't think we've really talked enough about the impact of pregnancy and birth on pelvic floor muscles and why that is such a pivotal time and sort of the role of pelvic floor muscles during that time. So maybe sort of let's just take a step back and talk to me sort of about what you see with your clients, the way that clients come to you, why they're coming to you, and sort of how you are, your thoughts around that stage of life, that because that really is when I think pregnancy and birth are, as you said, like the biggest traumas on our pelvic floor muscles.
So I normally see postnatal women rather than women that come in during pregnancy. So what I would say is if you are pregnant or going to be soon pregnant or thinking about it, I would definitely get a session with a pelvic health physio before, even before pregnancy or during pregnancy, mainly just to know, are you doing your pelvic floor exercises correctly? Birthing tips are always a good one. because we are in the most vulnerable state that we are possibly in when we're giving birth, especially first time. You don't know what's going on. Your body's never been through this, and you just accept medical professionals' advice of what they say and what to do. So mainly I see postnatal women, and I unfortunately see the women that have, I get a few, but not many, that just want to have things checked. I love those ones because I like, can you just check? Can you make sure everything's okay?
Yeah, you're
seeing
seeing women who are already symptomatic. That's why they're coming to you, I assume.
Yes. So they're already symptomatic, or they've had a traumatic birth where baby has caused tears and they've had stitching, and there's, they're just all a bit sore and worried and all of that. So I think I always say to my ladies who are pregnant that come and see me, is like, you need to give birth like an animal. So we need to give birth on all fours. Please don't lie on your back. Please don't lie on your back. If you have an epidural, you can lie on your side. You need your tailbone, so your sacrum needs to move to let baby's head out. If you lie on your back, you are in a higher risk of tearing because of the fact you haven't got that movement of your pelvis. So
you just don't have that range of motion because your lower back and your sacrum and your coccyx and that sort of that whole area is basically flat and can't move and doesn't have the mobility, the flexibility to adapt to a baby coming out. You're relying on only a certain area of your body to allow baby to come out.
Yes. And it's almost when women come in and they said, like, I've got a grade 3 tear or whatever. I'm like, okay, did you have any instruments? And they're like, yeah, forceps. I'm like, But it's a tough one because you're in this vulnerable position. You want everything to be fine. You don't want any harm coming to baby. And then they recommend forceps. I would say
I think it's the time when you are most surrendering to healthcare professionals.
Absolutely. And I think also, depending on your partner, it goes one of two ways. My partner was just silent for the birth of both of mine. Just absolutely. I think he was in shock. Or you'll have someone who advocates for you. So you need your other half on board. So if they say we're going to use forceps and you absolutely don't want them, you need someone to stand up for you because of the fact that you're in this vulnerable position. But forceps are one of the biggest reasons why such huge tearing happens. And I think in the UK, we are very quick to get the head out, too quick. We don't do any support of the perineum or that area. We want that head out straight away. And we have no regard to mum and what symptoms and everything else that she would be left with getting the baby out. It's almost like, well, you're alive, your baby's alive, what more do you want? It's like, don't want to be incontinent, and I want to be able to go on a trampoline, So I think you can be scary with these things, and I'm brutally honest, but if you can give birth leaning over the bed on all fours, just give birth like animals, squat. And the other thing that I recommend ladies to do is moo, like a really low moo, to kind of really relax that pelvic floor in order to help baby come out. Because it just softens everything and it will just help baby. But try and avoid instruments as well is a biggie.
Also, I do want to just focus on the actual birth and the needing to relax those pelvic floor muscles so that everything opens up, so that the baby can come out. And what do most women do when they are giving birth? If they, when they're in pain, there's that high pitched scream and the tensing up of all the muscles. So the face, the eyes, the hands, everything closes. If you are, as you've said already repeatedly, if you are tense in all other areas of your body, your pelvic floor muscles are going to close up. So it's just that the images we see of actual childbirth, of the screaming tight clenched woman, like your pelvic floor muscles are then in that situation not helping, because everything is tight, everything is tense, and you want to have as much relaxation as possible.
Exactly. And I know, you're probably in a hospital room, you're probably hearing other women labor as well. It's an
Yeah.
unknown environment. It's scary as hell. Let's not forget that part. It's
Yeah.
terrifying. And trying to relax in that situation is really, really
Yeah.
hard. And I think part of it is knowing that this is going to happen. At the end of it, a baby will arrive. It's going to hurt. There are ways and means that we can, reduce your pain. And if hypnobirthing, I was very much, before doing pelvic health, I was like, hypnobirthing, what's the point? Hypnobirthing, getting your breath right, getting in the zone, spot on. I'm completely complete U-turn on all of that now.
Right.
But it's just having those coping mechanisms to help relax you in a very stressful situation.
Yeah. And then do you advise women post birth, when they've healed, to start doing pelvic floor work to re-strengthen, to bring those muscles back into good functioning? And there's sort of the line that my pelvic floor muscles are never going to be the same again type of thing. Like, what do you see in terms of recovery?
So the biggest advice afterwards is, I would say, get your breath right. Go with the breathing. 100%, because baby's taken up that space of your lungs.
Yeah.
So your lungs are now free, but your brain has probably gone, I don't need to use my diaphragm, so why bother? If you can start with breathing first rather than
Yeah.
going anywhere near pelvic floor, I would definitely start there. And it's relaxing everything down. And then it would be, depending how sore you feel, because what you don't want, everything needs to be like sub threat, we call it. We don't want to cause any pain. If you've had a few stitches or some grazes and everything feels a bit delicate,
Yeah.
don't start tensing everything, because your brain will go, this hurts, I'm just not going to use this muscle. So let everything soften. I know that they send you away, they make you watch a video now in the UK where pelvic floor is on it for about 30 seconds. And anyway, they'll say you need to start doing it straight away.
Yeah.
Take your time with it. Make sure you feel comfortable. And if you don't feel comfortable and it's been a couple of weeks, that would be a time to go in and get checked out by pelvic health physio. To be fair, get checked out anyway. Go and book one in. I know it can be a little bit awkward, but a lot of women who've had babies go, I don't care, I've had a baby, I've had everybody look down there now. One person, extra person doesn't matter. But I think getting a natal checkup with a pelvic health physio after you've had a baby, whether it's a C-section or a vaginal delivery, is a must. It's so much better than the usual 6 to 8 week checkup with the GP, which is still questionable of why they're not really checking us at all.
Yes. Yeah. You mentioned something about cesarean section. I want to really important that you brought that up, because I want women just assume, well, I've had a cesarean, so my pelvic floor muscles are still intact. Can you please bust that myth also? I will tell you that out of my 5 pregnancy and deliveries, the first 3 were vaginal and the second 2 were cesarean. One of the reasons why I started my yoga journey and yoga for pregnancy and birth was because I thought, I've had 5 kids. I know what this is all about. I'm going to be the smartest one in the room, only to learn that I knew nothing about pregnancy, nothing about birth, nothing about my body, and reconnected to all of it again through the world of yoga. So yeah, talk to me about the impact of cesarean births on pelvic floor.
Okay, so first off, you've been carrying the weight of a baby on your pelvic floor.
Thank you very much.
So that's a lot. Weight of a baby and the fluid. So it's going to have some stress. It's going to have been under stress.
It's had to support you for 9 months. Even if it hasn't supported a birth, it still supported you for 9 months prior.
Yeah, exactly. So yes, you still need to do pelvic floor exercises. You cannot just assume that everything is fine because you've not had a vaginal delivery. That poor pelvic floor has really worked hard. And then we come on to the fact that the C-section itself, going through 7 layers of your abdominals in order to get baby out. And it is brushed off as this it's a C-section, it's the easy option. It is not. I've had 2 C-sections. And no one then comes along to tell you how to get your lower abdominals kicked back in again.
Yes.
So if you haven't got those abdominal muscles kicking back in, you're not supporting your pelvic floor again. Your
Yeah.
lower back is probably going to shout at you a little bit more because that's having
Yeah.
to work harder. Your pelvic floor is going to have a bit more tension
Yeah.
in it because that's having to work harder. So
Yeah,
the
I really want to stress that a bit, because I've also experienced cesareans, and I know that my abdominal muscles, not that they were so amazing to begin with, my two cesareans were after 3 births anyway. Your abdominal muscles do not go back, and I know that when I think one of the things I want you to just stress for a second is the anatomy of pelvic floor muscles. I know you've mentioned about lower back, hips, the pelvis itself, the diaphragm, but I think the role that the pelvic floor muscles play in female anatomy in general, and the fact that if you don't have good, strong abdominal muscles, which many women after pregnancy don't, and those women after cesareans, as you said, you've been cut through all your layers of skin and muscle. Women don't realize how profound a surgery cesarean is, and that it will impact not just recovery, after you recover, your scar heals, everything's fine, but actually your physiology, your actual anatomy has been slightly altered. So maybe just talk for a second about the actual importance and the relationship between pelvic floor muscles and what's going on in the rest of the body in that area.
So the pelvic floor muscles are kind of a unique group of muscles because they actually can, instead of attaching muscle bone on bone, is they actually attach onto kind of a ligamentous tissue. So that in itself is amazing and incredible, but because we don't have any bones obviously in between our two sit bones, they need to attach onto something else. So that helps with all of the function and the closing and the lengthening and the contracting of everything. So when you have got your pelvic floor, you've got your diaphragm, you then have your abdominal wall in the front and your back muscles at the back, is that you need your abdominals to function to kind of help keep all your innards in from the front part. So if you haven't got those abdominal muscles engaging, it hugely has a huge what am I trying to say? Impact. There we go. Oh my goodness. Huge impact on your pelvic floor, because your pelvic floor is then going to try and stabilize you a little bit more, as well as your lower back as well. So we've got all of these muscles need to work in unison, really, because they can't work on their own. Everything needs to work in harmony in order to have a lovely, strong pelvis and a hip and kind of like stand, really. I think if you're strong around your pelvis, you are strong everywhere else. So you can't have good pelvic floor function if your abdominals are weak. You can't have good pelvic floor function if your glutes are weak. So we need to look at all of it. And then you have a C-section where they rip the muscles. Actually, they don't tear, they rip the muscles. Your brain goes, that's not nice, I don't like that, let's not switch them back on again, or let's not engage them as well as we should, which then has that negative impact on the pelvic floor because it's not got that support structure that it needs in order to function normally.
I think it's really, really important what you've described and how you've explained it, because we are so used to, in our healthcare system, everything is siloed. So not only do we have the specialists and the ologists that deal with, the gastroenterologist, the gynecologist, the dermatologist, the whatever that is dealing with their own unique area of health. But then when it comes to pelvic floor muscles, as you said at the very beginning, that are these hidden muscles that we don't really talk about, that are very misunderstood, the relationship between their effectiveness and their good functioning and how they are actually held in place anatomically, and the relationship between them, the diaphragm, the abdominal muscles, the back muscles, the sort of the pelvis itself, the hip joints, and how the hip joints fit inside the pelvis, like how the hip ball actually sits inside. Like none of that is understood, and all of a sudden you've got pain in all random places in that whole sort of lower abdominal area, and no one thinks to check. Maybe it's the pelvic floor muscles that are sort of there holding everything together. You're looking at one particular, thing that's going on. And this larger concept of actually we're a body where all our different bits are all connected to the other bits, and that these muscles they're not just hanging out randomly in our bodies. They're there to do certain jobs. And I think that the way you've described it and, everything that you've been talking about is really looking at things from a very, very different perspective, because that is not the way that women's health is understood.
No, it's, I think what people try and do is make women's health very black and white. Yes. You have incontinence, Kegels. You have painful sex, do some stretching, dilator work, and that's it. We're not black and white. We're women. We have, those hormone cycles as well. It's wrong to try and put us in a box. I think with women's health in particular, and I think if you're going through a process of seeing an ologist of something, is that you need to have them to think outside the box and make them question their decisions that they're giving you, of like, is surgery my only choice here? What else could I try? Because I think with women's health, they do very, very easily just go, yep, do that. And that's it. And that's your only option. And if that doesn't work, well, live with it.
Yes. And live with it. Don't you just love the live with it? Okay. So as we come to the end of our conversation, and before I ask you the final question, I guess, what is one thing that you really want women, and especially I think sort of older midlife women, to really know about the pelvic health, about pelvic floor? What is the thing that women like one big myth or one big lie that you want to say, like, this is the, calling out the truth of it?
Okay. So I think, can I sneak two in? It's never too late to improve your symptoms. Don't think, I'm in my 70s, what's the point? It is never too late to improve your symptoms. That's the first one. I get a lot of ladies thinking they're too old for it. Never. Yes. And number two, it's not about Kegels. It is not about Kegels. If someone tells you just to do Kegels, it's not the best treatment
Go
method.
Find another practitioner.
Yeah, definitely. And if they refuse to give you anything else, leave them, never see them again, go and see somebody else. It's not about Kegels when it comes to pelvic health and these symptoms. So if you've been told just to do Kegels, I would question who you're seeing and definitely see somebody else.
Amazing. I think those are two really, really important pieces of advice and information. So as we do come to the end of this super fascinating conversation, I ask all my guests, this podcast is called The Things I Want My Daughters to Know. What do you want your daughter, your goddaughters, your nieces, that next generation of women coming up? What do you want, if you could stand on the rooftops and shout to them something, what is that message that you really want to impart?
I would say, don't ignore your pelvic floor. Learn about it. Learn about your pelvic floor and how your body moves. Don't just assume it's going to hold you together for the rest of your life. I'm educating my daughter already about her pelvic floor. I mean, I have a model pelvis hanging around the house that she's been fascinated in for years. So I think if we can just tell our daughters, granddaughters, goddaughters, younger generation that what the pelvic floor is and what it does, I think it will make a huge change to the next generation of mums and going through all of that. Yeah.
Really, really important. Unfortunately, that whole area, I love the fact that you've got a model. We know that there are a lot of those like pelvic models that have, all the anatomy there. And, the fact that we don't call female anatomy and female genitalia the exact names of what it is. And, there are all these cutesy names for all these different things. It's a whole area of women's health that still has so much shame and secrecy around it. And then we wonder why women don't know what's going on with their bodies when they haven't been educated even about the names of their own anatomy.
Yes. I had to tell you this story, but my husband and I had a conversation about what we were going to call my daughters. genital area. And I was like, well, vagina. And he was like, oh, can we not just call it a tuppence? Absolutely not. Absolutely not. No, definitely not. But you're right. You know, we have flowers and foo-foos and all of this stuff, and then it's almost like there's a shame to that area. So then when we get symptoms, women just go, oh, well, it's normal, isn't it? And we don't talk about it.
And that phrase which I think you used earlier on of like, I've got problems down there, like in 2026 we shouldn't need to use that language anymore. Like, okay, maybe in 1926 that was an appropriate language to use, but in 2026 I don't think you need to say down there anymore. So
no, definitely not. Call it what it is. Men do it, why can't we? You know.
Yes, that is very true. That is very true. Chloe, this has been so wonderful. Where can people find you? Where can they learn more about you, more about your work? If they want to reach out to you, where are you hanging out online?
So I'm on Instagram and Facebook, and I am at CE Physio Pilates. You can also send me an email. I'm more than happy to get back to people. I am Chloe at cephysio.com. I'm happy to help.
Amazing. Amazing. Thank you. Well, you have definitely made us more intelligent and more smart, and sharing your wisdom of just what is really going on. And I agree with everything you've said. You didn't challenge me on anything that I sort of said, no, that's not what I think. But you are talking a language that very few other people are talking about. And you're expressing and your understanding of pelvic floor and pelvic health. We really need to have more people like you out there talking with this language. So I really appreciate you sharing your wisdom with me, with the audience. Everyone, check Chloe out. You can hear that she really knows what she's talking about. And especially if these are things you have not heard from your healthcare practitioners, you want to go follow her, because she really is talking about things in a way that you will not hear from other people. So thank you, Chloe, for joining me. And to everyone listening, please rate, review, tell us how much you enjoyed this conversation. If it made you think about things differently, follow the podcast, subscribe, do all those wonderful things that you do with podcasts. And most importantly, listen with your daughters. As you can hear, this is an important conversation that we should be having with our daughters. So this is a great way for you to start that conversation. And I look forward to seeing you at another episode of the Things I Want My Daughters to Know podcast.